Good afternoon, and thank you for joining us on this Thursday afternoon to celebrate Earth Day. My name is Ali, and I have the pleasure of serving as your AMSA president. And today's event is themed around future physicians and policymakers partnering for a healthier future. This 51st anniversary of Earth Day reminds us of the importance of our climate crisis taking place in the midst of a pandemic and a national reckoning for racial justice, altogether demonstrating how one crisis is compounded by another. But with today's International Climate Summit taking place and our collective ongoing efforts, we look to the work ahead with hope. And we have an exciting event planned for you all today. Now I have the pleasure of introducing to you your national leaders from AMSA's Environmental Health Action Committee. First, we have our chair of the committee, Heidi, followed by our Environmental Health Advocacy Coordinator, Marcella, and our Environmental Health Programming Coordinator, Haley. And with that, I'll turn it over to you, Heidi.
Thanks so much, Ali, and happy Earth Day to everyone. Before we get on to our fabulous panelists, I'd like to take this opportunity to just say a few words. While AMSA was part of organizing the first Earth Day over 50 years ago, the organization only recently created this committee designed to focus on the intersection of the environment and our health. And in just 2 years, our committee went from being non-existent to being one of the most active and fastest growing in the organization. This past year alone, we held several advocacy action events, lectured to students from across the country, were published in national outlets, and encouraged Meatless Mondays and community cleanups galore. AMSA National's support of this mission was exemplified during convention, where they not only brought in excellent speakers on the topic, but also featured climate change as a major topic on Advocacy Day. AMSA members from across the country met with their congresspeople and senators and urged them to support legislation to fight climate change. Our AMSA leaders, Maddie, Ali, Ben, Zareed, Becky, Hannah, and so many others empowered us and gave us the opportunity to reach beyond our committee. Thank you guys, seriously, so much. And even with those resources and tools provided by our national leaders, I have to say that none of this would have been possible without the hard work of our EH coordinators, Marcy and Haley. Guys, I'm honored to have met you, to have worked with you, and to have learned from you this past year. You guys have been invaluable to me and to this committee. Thank you. And I think I speak for the three of us when I say we're honored to be passing this torch along to next year's leaders. To Bobby and to the rest of the team, we're so excited to see what you guys all accomplish. To me, the growth of this committee demonstrates the growing urgency we all feel we need to make a change to support our future. And while the issue of climate change feels overwhelming, this problem isn't insurmountable when we work together. So finally, thank you all for joining us today and every day as we work together to build a brighter, healthier future for all. And thank you guys for that. With that, I'm going to be presenting our wonderful panelists today. Thank you so much for joining us. Savita Portarazu is a current second-year medical student at the George Washington University School of Medicine and Health Sciences in the MD-MPH dual degree program. She is currently one of the co-chairs of the Climate Smart Healthcare with Medical Students for a Sustainable Future and one of the founding members of Climate Health Interest Group at GW. Savita is very passionate about promoting EcoMedical literacy and hopes this framework becomes a standard in medical training and continuing medical education. And Dr. Mona Sarfati is the director and founder of the Medical Society and Consortium on Climate and Health. She is trained in family medicine and public health and has engaged in teaching, research, and advocacy for 40 years. She started work towards the consortium in 2013 by assessing physician experience with the health effects of climate change in cooperation with the George Mason University Center for Climate Communication. She received her MD from the State University of New York at Stony Brook and her MPH from GW, George Washington University, and her BA from Harvard. Thank you both for being here today. If you all don't mind, I'd like to open with a little bit of time. We can start with Dr. Sarfati. Can you speak a little bit about why you're working in this space and what brought you to the intersection of environmentalism and health?
Yeah, well, first of all, let me just say that it's a pleasure to be here and to see this active group, an interest group within AMSA focused on environmental health. A colleague of mine and I both spoke to the AMSA convention in, let's see, it could be 2 years ago or it could be 3 years ago. And at the time, I'd say there was relatively limited interest in climate change or environmental health within AMSA. And so it's really exciting, to see that you have a fully developed committee to focus on these issues now. So my journey begins with regard to climate change and the environment, probably begins in about 2007, when the fourth IPCC report, this is the United Nations group, came out and included a section on the impacts of climate change with a whole chapter devoted to health. That received a fair amount of coverage from the press. And I heard that coverage, and the messages definitely sank in that there were human health impacts that were happening because of climate change. And the very next year, 2008, APHA, which I was a member of, I've always kind of walked this line between clinical medicine and public health. APHA had its National Public Health Week devoted to climate change, health, and the balance. At the time, I was teaching at Thomas Jefferson University in Philadelphia. And some of the physicians that were both in the public health program and also who were in the clinical medical program decided that we would have an event, a major event. And so we gave an award to somebody who was actually an engineer within the university staff who had, with great foresight, planned a highly efficient campus such that as the university expanded, it was actually using far less energy than it would have otherwise. And so we gave him an award, and we had a series of presentations. And as a result of being involved with APHA, I was invited to a meeting at George Mason that was organized by our current center director, Ed Maybach. So we're at the Center for Climate Change Communication, and Ed Maybach is the director of that center and also the founder. And because I was involved with the APHA meeting, he invited me to come to a meeting at George Mason. Well, that meeting changed my life because one of the speakers there was a climate scientist who explained that the models that they were working from at the United Nations were not the best models, they were the average models. In other words, they took all the models that were developed by the United States and Japan and Germany and every country around the globe, and they averaged them, and that became the United Nations official model for what was happening and what was going on with climate change. But this climate scientist informed us that, in fact, the models that showed much more advanced development of climate change were the ones that were most accurate. Well, that was my aha moment. And I realized that the situation was much more serious than we had thought. And so I had right at that moment resolved that I would like to work on climate change because I saw it as a great threat to health. But I went back to Pennsylvania, and at the time we were trying to improve the management of chronic disease across the state of Pennsylvania. So we had a big chronic disease collaborative, it was called, and we were using a particular model to try to get practices across the state to put in place the things that they needed so that a practice could do a decent job of helping people who had chronic conditions to be able to deal with them and more effectively. And so in the course of being part of that set of collaboratives across the state, I became quite concerned at what was going to happen to people who had chronic conditions as the climate deteriorated. And a colleague and I decided that we would do some surveys of physicians to get their thinking about all this. And so we did some convenience sample surveys, and we discovered that there were a fair number of physicians who were quite concerned about heat and the other things that were happening because of climate change and what that would do to people who had diabetes or chronic lung disease or heart disease. And so at that moment, I became quite interested in understanding what more doctors might be thinking about all this, because again, we were just doing small convenience samples at the time. And so I approached Ed Maybach at George Mason, who runs a world-class survey center, and said, I would like to survey physicians to find out, what they're seeing. Are they having patients walk in the door who were impacted by climate change in one way or another? And so he, responded immediately positively and said, oh, he would be delighted to have me come and do that. So I joined his group at George Mason in 2013. My husband and I moved back to this area. And I joined his group and partnered with medical societies to do some surveys to find out what doctors were seeing and thinking. And interestingly, we found that across the surveys that we did, there was very similar experience. So the physicians knew in numbers much larger than the population in general that climate change was happening. They knew it was predominantly, if not entirely, human caused. They thought it was relevant to the practice of medicine, and they thought their own patients were being impacted by it already. And they agreed on how they were being impacted. They felt that air quality was deteriorating, and that this was impacting heart disease and lung disease. They saw heat as a problem. They recognized that there were more patients they were seeing who had vector-borne, mosquito or tick-borne infections. They were concerned about waterborne infections. They were seeing more injuries if they were in places where there was severe weather. There were, a series of reports that were quite convincing. And then we asked them to give us some anecdotes about patients of theirs. And they actually provided a lot of really interesting anecdotes about patients who had stable allergy conditions until the last few years, who were now having allergy symptoms year-round rather than only in isolated seasons. They had patients who had experienced heat illness, who they didn't think, they felt were more exposed to heat now than they had been previously. They were definitely seeing more heat illness. Some were seeing more tick-borne diseases. It was all right there in their experience. And so on the basis of, and furthermore, they wanted their societies to do something. They felt that doctors had a responsibility to speak out, to inform their patients and the public. They wanted their own societies to speak out, and they felt that physicians should be involved in environmental sustainability in their workplaces. So on the basis of that, we brought together some of those societies to discuss this. And they indicated an interest in coming together and forming a group. And so we established this consortium. And when we started, we had 8 members. This was back in 2016. And then each year that group grew so that we now have 32 member societies. And those are some of the largest societies. So together they represent more than 60% of all physicians in the US. And then we also began asking some public health groups whether they would like to kind of affiliate with us and indicate that they agreed with our concern about the health harms of climate change and the health benefits of climate solutions. And so we started accumulating affiliated groups, and now we've got about 60. And we also began asking individual physicians if they would like to be advocates. And so we now have almost 1,000 individual advocates who aren't covered by one of the other categories. And some of those affiliated groups are actually state-level clinician groups. So there are 16 state-level clinician groups. So we've got a lot of components at this point. And we like to say we organize, empower, and amplify the message of physicians about how climate change harms our health and climate solutions can benefit our health. And as of last year, we not only were organizing, empowering, and amplifying, we also added mobilizing. And so we are now very involved in trying to get the word out to our representatives that physicians are seeing health harms of climate change, that we think solutions are essential, and that if we do implement solutions, we'll see real improvements in health. So I guess I'll just stop there. and turn it back over to you.
Absolutely fabulous. Thank you so much for providing that context and for all the work that you've done. I think that you and your colleagues, your generation, has paved the way for folks like us to be involved from the beginnings of our career in this fight. And so, Savita, I'm wondering if you can give a little bit of a talk about why you're working in this space and what brought you to this intersection of in the environment and health.
Yeah, absolutely. Thank you for having me here. And thank you, Dr. Sarfati, for your very inspiring story. It's amazing to hear that current providers are already taking action and that we medical students and students in other health professions programs are very motivated and encouraged to follow in your footsteps. And I guess with my own story, I did my undergrad also at GW. And it wasn't until I took a course in climate change and policy that I was really trying to put together the intersection with impacts of climate change on human health. And this was a part of a major that I was pursuing in social determinants of health. And so I started to begin to see climate change as a determinant of health. And as the course went on, they didn't really emphasize how much of an impact it was having on health. And we talked a lot about other sectors like the business sector and like at the federal level, what can be done. And so I had this growing curiosity to learn more. And when I studied abroad in Switzerland, I had more exposure to the United Nations Environmental Program, World Health Organization, and people who are working at a very different level, but with the intersection of climate change and health. And like Dr. Sarfati was mentioning, it has gained a lot of traction in the last few years, at least in my eyes. And while I was there, I conducted some more research on this very topic and happened upon the new field of EcoMedical literacy, which Heidi mentioned earlier. And so I wrote my senior thesis on what EcoMedical literacy looks like in practice, and I interviewed a bunch of not just providers, but people engaged with policy, people in engineering to see what they think about EcoMedical literacy and how it can be implemented in clinical practice, in promoting climate smart healthcare. And once I started medical school, because I knew that was the direction I wanted to go in, I actively sought out opportunities to keep cultivating this interest. And so I met Harleen Marwa, a current fourth-year medical student who started Medical Students for a Sustainable Future, and is now a group of 425 plus students globally, 85 plus medical schools, with students just like me who are so passionate about the greatest threat to human health this century and what we can do about it as aspiring providers. And so it's a very organized community of people who promote curriculum efforts at medical schools, community engagement, advocacy, everything. It's such an exciting environment to be in, and it is growing so quickly. And so that's kind of the trajectory I've been in. I've also been involved in GW's own curriculum reform efforts when it comes to integrating and promoting EcoMedical literacy in our curriculum. Just last week, we met with our curriculum deans and gave them a presentation about what the known climate health impacts on human health are and how we recommend integrating specific learning objectives and how that translates into our lectures, into our case discussions on the wards, and ultimately in our patient care, which is the ultimate goal. So in a nutshell, that's where I am right now, and I'm happy to talk more about my experiences.
That's awesome. Thank you so much. And I'm wondering, this builds perfectly for our first question, which is, what can medical students do to be more aware of the effects the environment has on patients' health? So do you mind covering that? Maybe Savita will take you first.
Sure. Yeah, it's a great question. I think there are a lot of layers to this answer. I think primarily just educating yourself about new research that's coming out there. There are lots of tools that are coming out. The New England Journal of Medicine has a climate crisis and healthcare delivery tool. It's really, it's laid out in in a very nice way, where it has like different organ systems and specialties and research relating to that. I think it's very user-friendly. With that, I think having a foundation in our own medical education and promoting EcoMedical literacy in our own curricula will be a great way to standardize it in our education. It takes some investing energy in terms of establishing this at each person's medical school. And so in addition to educating yourself, in addition to promoting climate change education, I think we are all responsible for following the science when it comes to the impacts of climate change on health. It can affect every organ system, as we're learning more about every single day, and how that translates into the care that we're going to provide our future patients. I think the pandemic has kind of overshadowed the climate crisis in a lot of ways, and I think that is more of a reason for us to pay more attention to emerging research. So I think those two things are the biggest things.
Yeah, great answer. I really appreciate it. Dr. Sarfati, same thing for you. What can medical students do to be more aware of the effects the environment has on patients' health?
That's a really good question. And I think, one very important answer is to think about the social determinants of health and the risk factors. So, when you see patients and you're asking this kind of the standard required questions that are part of the history of the illness and trying to understand what it is that's happening to them, understanding more about where they live and how they live and what kind of work they do and what their home circumstances are, and how their living situation or their work situation may be placing them at risk for the conditions that that you're asking them about. But I think you really have to have an approach to your inquiry about individual patients that includes attention to risk factors and to social determinants of health. And some of the very specific kinds of exposures that are related to climate change include heat, of course. And, when people may deteriorate, if they have chronic conditions, was heat a factor? Was cold a factor? Where are they experiencing that deterioration? Was it outside, and in what kind of weather? We know that many people who live in cold climates and have poor insulation are more likely to get into trouble, especially in the colder months of the year. And in the hotter months of the year, you have certain populations that are more likely to get into trouble because of exposure to the heat. And that includes children who spend more time outside. It includes people who work outside or people who may be homeless. And it also includes elderly people if they live alone and they don't have air conditioning, or people of any age if they don't have air conditioning. And so understanding how people live and what their circumstances are really helps to inform your picture of what the social determinants of health are for the individual. And so that's extremely important. And that extends also to people who have problems who may be related to allergens. If they are getting into trouble during allergy season, why is that the case? And is it home or is it outside? And if it's at home, are they living in an environment where the indoor air quality is poor and where they don't have good systems that filter the air? And I'd say, for many people, that is definitely the case. And so that's something to be aware of. And then, of course, when people have infections, where did they get infected and why did they get infected? And not just what is the organism, but what were the exposures they had? What were the activities or the places that they were that placed them at risk so that they were exposed to those organisms? And it's the same thing with conditions that deteriorate because of weight. And then you have to ask yourself, well, why are these people experiencing weight problems so frequently? And is it related to lack of poor food? So I think, some of this really does come with a curriculum that includes much more focus on social determinants of health, because we know that although everybody is at risk for the adverse health effects of climate change, that some people are at greater risk. And that includes children, it includes the elderly, it includes pregnant women who are more vulnerable to heat, it includes poor people and people who live in communities that have historically experienced environmental injustice. So I think that should be part of the education, and it's important to think about those things.
Yeah, thank you for that. I appreciate that answer. I know that when we talk about any of these determinants of health, so many of them, we have to address the root cause back. Some of the root causes can be addressed through policy. And I'm wondering if you can speak a little bit to the major challenges to having meaningful climate change policies implemented. Can you kind of talk through those challenges, Dr. Sarf?
Yeah, absolutely. We like to say that our mission is to inform the public and policymakers about the health harms of climate change and the health benefits of climate solutions. And we want everybody to know a few things. We want them to know that health harms are happening now, that although everybody is at risk, some people are at greater risk. And I mentioned the people who are at greater risk: children, the elderly, people with chronic conditions, poor people, or people who live in neighborhoods which have poor environments, poor insulation against heat and cold. And these health harms, the third thing is that these health harms are going to increase unless we address them. But the good news is that we actually know how to address them. We just need to do it. And once we do it by changing our energy mix and moving over to low carbon or no carbon transportation and improving HVAC systems so we have more efficient use of energy indoors and making neighborhoods greener so we have better insulation against the heat and cold from greenery in the neighborhood, that once we do all those things, people will be healthier, and the air will be cleaner, and the water can be cleaner too, because as we change to cleaner forms of energy, we don't have those particulates that are precipitating out and landing in the water along with the heavy metals that they carry and so forth. So the solutions actually can make us healthier. They can clean our air, they can clean our water, they can make us healthier. And we need to win over the public, and we need to win over government officials so that they understand these basic messages. There's 5 basic messages. They really need to understand them, and they need to understand them so well that they can stand up to the vested interests who are going to try to keep, lining their own pockets, because they're concerned about losing the economic benefits that they get from the current forms of transportation or energy generation or whatever they are. So health voices can make a difference here, because people trust us. They trust doctors, they trust nurses, they trust pharmacists. And we are used to talking about complicated scientific problems to the public. One of the things that we do is we translate scientific issues for the public and help them to figure out what they should do about it. They trust us, we can help them understand, and we need to use our voices to inform them so that they are able to support solutions, and ultimately so that they also can stand up to vested interests, because there's no question that the vested interests are going to keep pushing to try to maintain the status quo.
Yeah, so I heard educating both physicians and the public and policymakers on how to communicate this material so that they can stand up to the challenges of vested interests, basically. And
yeah, exactly. And we found actually that a lot of policymakers really appreciate learning this information about health, because we tell them, we are not about politics. We're not supporting, a partisan agenda. We're concerned about health. We've been trained to take care of people, to be concerned about people's health problems. And that's what we do. And that's why we're involved in this. It's because of health. And when we tell them stories that they can use to illustrate some of the health impacts and why it's important to address climate change, it's a big relief often for them, because when somebody accosts them back in their home district and, from who disagrees with them, they can tell a story. They can tell one of the stories that we've conveyed to them that shows why it's important to address climate change.
And stories are so much more powerful sometimes than statistics or numbers or scientific facts. Yeah, thank you for that. I'm wondering, Savita, if you guys at Med Students for Sustainable Future have seen any particular challenges to having meaningful climate change policies implemented, and what you see those might be as well. Do you have anything to add?
Yeah, I think Dr. Sarfati brought up really important points. And I think something that I want to emphasize is that we, as medical students, are going into a very trusted profession. That's something that they teach us from day one. And they show us this graph of like all these different professions, and healthcare providers are like way at the top. And I think that's really powerful, especially as we navigate climate change policy. And I think when I took that first class that introduced me to this topic, there was a lot of talk about how polarizing climate change can be in some communities in particular. And when you bring in the topic of health, I think people first question, they're like, how is climate change affecting like my health? How is it affecting my family's health? And I think when you break it down to different cases and different stories or different natural disasters that people have seen on the news or have lived themselves, I think it adds a lot more weight. It depolarizes it a little bit. And I think that might be kind of the magic bullet here when it comes to advocating for more climate change and health related policies. I myself don't have a ton of exposure to climate change policy. I think something that MS4SF does really well in the advocacy branch is reaching out to local senators and representatives to advocate for this very topic. And I think so how the organization works is people kind of divide themselves into a specific branch that they want to get more involved with. So in the advocacy branch, they do a lot of participating in engagement, community engagement, or educating policymakers. And then in the research branch, it goes into that developing the evidence to support the advocacy branch, because a lot of what we're talking about has to be backed by evidence in order for policymakers to take us seriously as well. So I think a lot of these arms of MS4SF work synergistically, and I think that is the way that the climate crisis should be navigated. It's not just advocating for policy, but using science to guide policy, and to use that science to also guide curriculum reform. So I think it's a very complex approach, but I think MS4SF does a really good job of figuring out how to strengthen each arm so the sum is greater than its parts.
And I think it's a wonderful model. It's a wonderful model. I'm wondering, we kind of talked about this a little bit already, but I want to just hit on this quickly. How can we increase awareness of this issue without politicizing the subject? So when you're faced with people who automatically, when we talk about climate change, become hardened because they're so ready for the political talk, how can we make this not political?
Yeah, well, from very early on when we launched, some of there were some news outlets in different parts of the country that really wanted to put us in a political box. They immediately assumed that we were, taking a political position. And we were just very clear about the fact that we were nonpartisan. We don't support candidates. We don't even support specific pieces of legislation because we're a 501c3. So we can support solutions. And we can say we prefer one type of solution over another solution, but we, as a 501c3, we can't really say we support any specific bill number or bill name. And so we are really, concerned because of the health implications, the health consequences of climate change. And it turns out that that is a very powerful and convincing argument in itself when they have polled people across the country at, what arguments work for them. It turns out that health is a very powerful reason to want to see solutions put in place. And the next most powerful reason after health is the stewardship involved in providing for children and for grandchildren, a healthy and sustainable environment, that passing on a healthy planet, a healthy community to our children and to our grandchildren turns out to be a very powerful motivator. So that's a discussion that you can have with a policymaker on a very human level. As a health provider, who's better really to make the health case than you are? I mean, we are the experts about the health implications. And so, if we say, well, the number of people who are suffering heat illness, or the number of people who are facing flooding, or who are having lung problems because of wildfires, or, who are experiencing Lyme disease and other tick diseases, that's increasing greatly. And it's, we're seeing 2 to 3 cases a week, where we used to see, sort of 2 to 3 cases a month. These are things that we can tell them that, really are squarely in our area of expertise. And so we can give that testimonial, and it really is about our work. And we can talk about, that woman who went into premature labor, who was in very, very hot weather and, spent too much time outside, and then went into premature labor. And that premature labor is a lot more common because of heat. And it's also a lot more common where women are facing poor air quality, which happens, associated with heat, and is also associated with burning of fossil fuels, or burning forests and wildfires. So, or we can talk about those children who we saw who had heat illness, where heat illness was not terribly common in children a decade ago or 2 decades ago, and now it's become a lot more common. And some of the most frequent presenters to emergency rooms with heat illness are kids who play sports in school. So high school athletes are a lot more likely to get into trouble from heat illness. And that problem is increasing. And so we can tell stories about that, if we happen to know specific stories, or we can talk about it in general and just take a story that we've even heard about from a colleague. And so these are things that we can speak about first person that are definitely going to be of interest. And if it's a story, and we are the people who have the expertise to talk about why that's a problem. If we're talking about the stewardship for our children and grandchildren, then, at the human level, that's really reaching, anybody who's concerned about children and grandchildren. So that's another way that, we can talk about this, that has been shown to reach people. It reaches legislators, it reaches people in general very well. One of the things they do at George Mason, where we're located, is they do message testing. So we're in a communication department. Our whole program is in the Department of Communications, and they study, what communications work and why they work, and they study messaging and they test messaging. And it turns out that these 2 areas of messaging are effective. So anyway, so that's how we deal with the accusations about being political. We just don't agree to that. It's just not who we are. We're not politicians, we're physicians.
Yeah, I appreciate that. Don't even engage on that level. Savita, do you have anything to offer on how we can increase awareness of the issue without politicizing the subject?
I think something that really comes to mind is making this a health literacy issue. Like, would you really want to deny patients the opportunity to learn about how the environment is affecting their health. Like Dr. Sarfati was mentioning, if parents or expectant mothers or even kids growing up don't understand what's happening to their bodies and why it's happening, they're not going to understand the interactions of how emerging health threats are going to affect their lives or their kids' lives. And then that brings into the question of intergenerational equity, where we want to create a planet that is safe for our own kids and their kids. And so it brings in a lot of like bioethics, and I think something that ties really well into the framework of EcoMedical or eco-health literacy is the foundation of sustainability and bioethics. Like, if you make it political, then maybe some of this information won't get to the communities who need this information most. And for the people who can access this, they may be able to take precautions and be more prepared in certain like extreme weather scenarios or in more gradual chronic weather scenarios that will ultimately affect their health. So I think it's really important to make this a question of health literacy, and whether current providers or future providers are willing to include this in their standard conversations with patients that they see, and regardless of what specialty that they're in.
Great answer. We have about 12 minutes left of this before we hand it over to Marcy, and I'm going to start transitioning towards some of our audience questions. So anyone in the audience also feel free to chat or put it in whatever forum you're viewing this from, Facebook, YouTube, Zoom. We'll get your questions and get them to me. But I want to start with one on what we say to people who feel like it's too late to address irreversible climate change impacts, or that current work like the Paris Climate Agreement doesn't go far enough. Do you guys have any words for those folks?
Oh, well, that's, let's see, am I on mute? No, I'm not. Okay. So that's a good question. And I think that, it's not hopeless. We can slow the pace of what's happening, and we can protect ourselves and a lot of other people. And especially as physicians, who have taken oaths to protect health. That's a basic value for us, that we don't want to do any harm, and we want to heal, and we want to protect people. So it's not hopeless, because things are still developing and changing, and every day we hear about how things are developing and changing, and so we really have to act. And acting will make a difference. We know it'll make a difference. It's not hopeless. We know what needs to be done. The things that need to be done are pretty straightforward. And furthermore, when we do them, the benefits are almost immediate. So if you stop producing, if you close down a coal plant, everybody who lives in, within hundreds of miles to that coal plant will be breathing cleaner air, and that will benefit them. And not only will it benefit them right away, but if they're children, it will mean that they are more likely to have more lung tissue, because it's been shown that children who grow up breathing dirty air literally have less functioning lung. So, it will benefit people right away if we shut down those coal plants. All those particulates that come out of the coal plants are directly and immediately hurting somebody. And if we shut down that coal plant, then that hurt won't be happening anymore. So the impact is pretty rapid. And it's the same thing for some of the other fossil fuels. If we shut down some of the places that are leaking methane, we won't be exposing people to methane. And it's been shown that women who live within certain distance of methane operations are more likely to have premature deliveries. So you can actually, improve the outcomes, pregnancy outcomes, in a pretty short in time of a pretty short turnaround. So, in that sense, not only are the impacts can we change the impacts and change them quickly? We can change them right where we make those changes. So it's very local. The benefits are very local. They're right there where people are exposed. And, that's, I think, some powerful logic that you can offer people.
Savita, do you have any other thoughts?
Yeah, this question came up a lot in that climate change class that I took. And one of the professors put like this spectrum on the board and was like identifying where different sectors of society kind of fit on the spectrum. So it ranges from the individual level all the way to like government policy. And, everyone kind of has a place in that. And some people may be more inclined to contribute in the fight against climate change, depending on where they are on that spectrum. And I think when you're thinking about where you stand on the individual level, it's easy to feel that burden, or it's easy to be overwhelmed by how much needs to be done or to reach these numbers that are published in like the IPCC or the Paris Agreement or the Lancet Countdown. It's easy to get overwhelmed by that. And I think that's a very valid feeling. At the same time, I think it's important to put yourself in perspective on that spectrum and figure out how and whether you want to contribute to a different part of that spectrum. For someone who is an aspiring physician, I want to contribute to the fight against climate change as a physician. For someone who wants to go into policy, for someone who wants to go into business, there is a place for everybody. And I think when we give somebody else the opportunity to contribute, it's going to amplify the effect even more, whether that's greening the business sector, or that's just one example that comes to mind. But I think it's important to put it in perspective. And I get the question a lot, like, if I recycle, is that going to stop climate change? Like, it's a very small percentage of a contribution to cleaning our environment. And I think it is so much more than our individual daily practices, but those are important, and understanding the science is important, and communicating the science, and those who communicate it need to be transparent about it. It's an all hands on deck approach, and I don't think anybody's alone in how they feel about climate change. But I think this community does a really good job of supporting interests and bringing people on board. So very grateful to be here.
Yeah, that question about recycling, it's one that I definitely is a big focus of my attention recently. I grew up near the ocean. So, I think people who ask about that, may not realize that there's so much plastic. That first of all, there are people who live in poor countries who are literally being paid to take our garbage. And, that's wrong. I mean, that's just wrong, that somebody has to earn money by taking our garbage. And it's largely our plastic garbage. So that's one thing. And then the other thing is that there's so much plastic that's gotten to the ocean at this point that it's no longer just the plastic garbage patch. People who study the water microscopically are finding, that the water, it's like a plastic soup. So, this is something which people really need to be aware of. And, it's really become so fundamentally part of the food chain that scientists are concerned that it's actually impacting, life in the oceans, all the life in the oceans. And there are people who, who are depending upon that life in the ocean for their lives. So, I think the moral and justice piece of this is something we can also talk about. Especially if we feel it with conviction, I think people can hear that.
Yeah, I recently went to one of the museums in my town, Norfolk, which is on the ocean, just had a National Geographic exhibit that was showing pictures of the plastic trash that was being washed up on other shores. And there were pictures of classic beach scenes, like a man surfing, but he was surfing in trash. He was surfing in trash. And it was just, the visuals were arresting and spoke so much. A picture says 1,000 words. I'm wondering really quickly, we have a question for Savita. Can you define what EcoMedical literacy is?
Yeah, I apologize for not doing that earlier. It's a great question. So EcoMedical literacy is the ability to understand, communicate, and integrate the health impacts of climate change on human health. In the same way that if you think about just regular old health literacy, like how you know how to fill out a form at a doctor's office, how you understand what a doctor is telling you, how you understand what your antibiotic that you just got prescribed does to your body, like that's health literacy. Ecomedical literacy is something that healthcare providers are trained to know. For example, say in a lecture, I learn about how heat stroke is impacting maternal and child health. And I translate that into eco health literacy one day when I'm a doctor, say I become an OBGYN. And I have a conversation with a woman who is pregnant, and I'm explaining to her how like this extreme heat might be affecting her and her baby. So that's kind of the pathway that it would take. It's the knowledge that I get and understand about how heat is impacting maternal and child health, and then me communicating that to the patient. Eco health literacy is on the patient side. So they're kind of two sides of it. It is up to the provider to translate that in a way that is effective for the patient. Hopefully that clarifies things.
No, it does. Thank you. And also speaks to the importance of working across sectors and encouraging K through 12 education in health literacy, which can be lacking depending on where you're coming from. In the last few minutes, I just want to leave the floor to you guys, and just if you have any other thoughts or feelings that you want us to take away from this discussion, feel free to share them now. Do you guys have any other things that you want to add or last minute thoughts? You're muted. I'm so sorry.
Sorry. I would definitely like people to know that the Medical Society Consortium is having an annual meeting that starts on Friday night, May 21st, with several workshops. And so there's one on plant-forward cooking, and one on should I buy an electric car, and another one on how to green my practice. And then on the morning of Saturday and Sunday, after that, we've got some CME sessions, and in the afternoon, we have policy sessions. And then Monday night, we prepare to visit Congress on Tuesday. And so on Tuesday, we're going to be visiting our members of Congress, both senators and our congressional representative. And we would like to, get the word out to medical students across the country, doctors across the country, that this meeting is happening. And we are really trying to bring our voices to Congress. I mentioned that we've been moving to advocacy. And so we have actually hired a full-time advocacy coordinator, and we've just purchased that software that allows you to see day by day what's happening in the legislatures, both at the federal level and at the state level for our state affiliates. And it will also allow us to be in touch with our members of Congress, not just on the day that we actually have these online visits, but on other days during the year. And so we really are trying to build up this kind of, sense of a tremendous outpouring of interest across the country by medical people, doctors and nurses and other health professionals, that we need to have solutions in place, policy solutions in place to address climate change. And so this meeting and that Tuesday really is going to be kind of the beginning of mounting that major effort, which will extend over the course of the year. And we have a guide for that because in 2019, we released something called the Call to Action on Climate, Health, and Equity, a policy action agenda. And so in that call to action and that agenda, there's basically 10 points that lay out what we think needs to be done to address climate change. And most of the points are also good for health. So moving to low carbon or no carbon transportation, obviously, if we do that, we won't be spewing, pollution into the air that people will be breathing. If we improve energy efficiency, then we won't need as much fuel to heat or to cool. And so that will clean the air. And then there's regenerative agriculture. And so there's basically 10 points, and 6 of those 10 points are directly beneficial to health. And you can find that agenda at climatehealthaction.org. I think AMSA is actually a signer, an endorser of that program. And so that program is going to guide us in this ongoing relationships that we're trying to build with our members of Congress. And so we, urge everybody to consider joining us.
Thank you. We've shared it on all our channels, and we'll be sharing it with our members. Thank you so much.
Great.
Savita, do you have any final thoughts or comments you want to share?
Sure. I'd just like to say that for anyone who's watching, clearly something piqued your interest about climate change and health. And I think it's important to capitalize on that interest and get involved in any capacity that you can. As I mentioned earlier, it's a growing community, and there are so many different ways to get involved, whether you want to be an entrepreneur, you want to get involved in policy, you are going to med school or applying to med school. There are so many different ways to get involved, and reach out to people, reach out to me, reach out to Dr. Sarfati. We are part of bigger organizations that are very well connected to people all across the world. So all it takes is an email or a message to just reach out if you're interested in learning more or just participating in general. So thank you all for being here, and thank you for having me.
Thank you both. We so appreciate you guys joining us today. Thank you. And with that, I'm going to pass it on to Marcy, who's going to be sharing with us our Advocacy Ask on this Earth Day. Thank you so much.
Thank you.
I'm just going to share my screen. Can you guys see that? Okay, so I know that sometimes talking about a subject like this is really broad, and it just seems like really outside of our reach. Aside from like recycling and those things, we really want to encourage you to go out and talk to your senators and reps. We specifically picked this Thrive agenda. I know that there's a lot of really good legislation out there, including some that were reintroduced today, but I just wanted to highlight this. So the Thrive agenda is really a really broad resolution that's hitting a lot of different marks. So the first is the cost, because that's what a lot of people are concerned about. So this would invest at least $1 trillion per year from the period of 2022 to 2031. And it has a lot of different goals. First is to tackle the unemployment that has been caused by COVID. So this is aiming to create about 15 million new jobs. And with that, these would be jobs that would be paid with a decent salary, that should have benefits like pension and early retirement, and also should have access to unions. Additionally, it would be transforming the power sector to be carbon pollution free by 2035. And it hopes to address a lot of the injustices that have occurred by, first of all, wanting to create like a board of reps from people and communities who are most affected by environmental injustices, and also requires that half of the investment be directed to these marginalized communities. And then also hopes to create a ton of infrastructure to have more accessibility to wind and solar power, and to improve certain jobs such as the care for our elderly and our children, and really just pushing a lot of more stability in our electric grid and things like that. So what we want you to do is to email your reps and senators. You can also call them, that's totally okay. And I made a template for you guys to use. It should have some blue text, I believe, for you to just change your name and address, because they're interested to know that you would be a constituent. And then you can just edit it. And like we mentioned earlier, personal stories often make them, for some reason, more convincing. So use personal stories if you have any, and email them out. These 2 websites provided would allow you to locate who your senators and reps are. I can post them below also. So if you want to get involved and know more, you can reach out to us. And then definitely let us know if you've emailed your senators and reps. And I know we've been posting a lot of content on Instagram all week. So if you want to make any of these sustainable changes that we suggested, take a photo and tag us. that's about all I have.
Thank you so much, Marcy, and thank you to the panelists, to our AMSA leaders, to all of you attendees. We so appreciate you coming here today and celebrating Earth Day with us and sharing your knowledge and your hope. So thank you guys so much for everything. Have a wonderful rest of your Earth Day, and we'll see ya. Thanks.